Hi, if you are facing any issues while joining the link, please have you shared your
Hello?
link?
Can you hear me? Can you hear me?
Hi,
Yes, the moderator has not joined. I don't know. He's having a problem joining. I don't know why he's not here.
okay. Uh,
Um, the moderator.
yeah, so you are the speaker?
No, I'm not the speaker. It's Favor. I'm still Favor.
Okay, okay. So,
Yeah.
uh, what is the issue exactly?
Please.
Can you explain?
Okay. Take your WhatsApp.
Hello, Junie.
Yes.
Junie, I don't really know what is wrong. The guy is still telling me that he can't join the meeting. And
I
But the
can
unfortunately, I
professor
said,
see,
has joined.
yeah,
I
we
think
can,
I think he's a problem
yeah,
because
he has,
everybody
sorry?
is one.
the professor has joined.
Yeah, the
Yes.
presenter has joined, but we're actually looking for the moderator. Maybe if he's not here, maybe I can stand in for him.
Yes, you can do that because I think the fault is
The
from
reason
him.
why the reason why I actually wanted him to be the one was that I was traveling to Abuja and I just got to my hotel now. So I gave him the role to be the one to handle the stuff. Maybe I'll have to stand in for him then.
Yes, you can start now. You can start now. Then we can.
Hello, everyone. Good evening. Can we all hear me? Hello, everyone.
Hello.
Can we all hear me?
Yes, loud and clear. Yes, we can hear you.
All right. So welcome everybody. I'm Joe Ekosis of my name, and I was not supposed to be the moderator for this meeting. The moderator is supposed to be Idris, but currently he's having a problem. Hello.
Yeah, okay.
Can you still hear me?
We can hear you.
Hello.
Yeah, hello.
Okay. I should go ahead, right?
Yes, I think we should start.
All right. All right. All right. So, like I was saying before, the moderator is quite having a problem joining the meeting. He's supposed to be the one to handle this. But when he's not around, I think I should be the one to head the meeting for now. So today we want to talk about it's actually a program organized by NIMESA National. I know everybody here might not know what NIMESA stands for. NIMESA is just an acronym for Nigerian Medical Laboratory Sciences Student Association. And this particular program is organized by the health department, the health directorate of the association. This is one of the programs we do, and it's called. Hello.
Yeah, please continue.
Hello. Yeah, I'm hearing some background noises.
Yeah, it's muted now.
All right. So, like I was saying before, this is actually a program organized by the NIMESA National Directorate of Health Advocacy. So, like I was saying before, sorry for distraction, is a program organized by the NIMESA National Directorate of Health Advocacy, and this is one of the things we do. We create awareness about health, and we tell people about the diseases they suffer, which they don't know mostly sometimes. So this monthly health outreach or monthly health talk is what we do to discuss some of these prevalent diseases. And this month, June, we've actually brought out a trending topic, and it's going to be the monkeypox outbreak in Nigeria. So when we have invited a renowned professor of medical virology, Professor Miriselin M. Baba from the University of Maiduguri. So she's going to be the one to lecture us today. And I welcome everybody to this particular program. And I think we should call a professor to start right away. So maybe one of us join, they can continue from wherever we are currently.
All right. Good evening, everybody. Good evening. Are you hearing me?
Yes.
Yeah. Good evening, Ma. Where with you, Ma?
Yeah. I sincerely want to thank Namelsa for inviting me for this talk. I must apologize for one thing, that I didn't prepare the PowerPoint. My schedule has been very tight, so I didn't prepare the PowerPoint, but I believe that as a virologist practicing the profession for over 30 years, I should be able to say anything on any virus of medical importance when need arises. So I believe I have, from the issues you raised or concerns that you want me to talk about, I think I can handle it. So, but if after the talk and you still feel that I should send a PowerPoint to share, I don't mind, I will do that. But for now, please bear with me. So please, I'm ready to address the questions as you prepared for me. Unless you just want me to talk blindly, but it's better for you to ask me questions on topics or aspects you want clarification or you want knowledge on, then I'll take off from there. Thank you. Hello? Hello?
Yeah, we can hear you.
All
Yeah,
right.
well, with you, Ma. Please, can you just repeat what you said before? Don't be offended, Ma.
What I said, my schedule has been so tight. I didn't prepare PowerPoint presentation. I didn't prepare PowerPoint, but I believe that as a virologist who has been practicing for over 30 years, that I can discuss, I can talk at any point in time on any virus of medical importance. So I prefer you asking me questions and me responding to whatever issues you want to know about monkeypox.
All right. Thank you so
you
much.
Heard me now?
Yeah.
All right.
Yeah, I got you.
All right.
All right. Thank you so much, Ma, for the opportunity. But not everybody here, like I said before, is a medical student, and not everybody here is a medical laboratory science student or a medical laboratory scientist, so to say. So some of us may not actually know what monkeypox is all about. If you take this down to the villagers and tell them about monkeypox, they will just be looking at you because it sounds somehow funny. So a layman may not really understand what monkeypox virus is. Please, to a layman, how can you explain, tell them what monkeypox virus is all about?
All right, thank you very much. Monkeypox is a disease, and in most cases, it manifests in the form of rash. And that rash is different from rash caused by measles, because this rash will start first as just small flat surface rash. Then it becomes what we call macula. We call it mascular, and then it becomes raised. Then from there it becomes vesicle that has something inside. Then it develops again into pustule. From pustule, it forms crust or scab, and then it can fall off from the skin. So that's a kind of disease that monkeypox is. That's the typical, not that it has no other clinical features. It has, because it starts normally with fever, non-specific symptoms, but this particular kind of rash typifies it as monkeypox. Why it is called monkeypox? Because it was first isolated from a monkey. That was in 1958. And then eventually it was transferred from monkey to human. So that's why it's still maintaining the name. But right now, I think WHO is at the verge of renaming it instead of naming it as monkeypox. But it's not yet known, but we still believe it is monkeypox. So this monkeypox is caused by a virus. I will try as much as possible to avoid the jargon, medical jargons, like you said, so that everybody can follow. So it is caused by a monkeypox virus, and this monkeypox virus is a DNA virus and is a double-stranded DNA virus. It belongs to the genus Orthopox virus, and it belongs to the family Poxviridae. It has two genetic groups. There is one genetic group that is commonly seen in Central Africa, example like DRC. Many people in DRC have that one. And there is another, the second one that is circulate in West African countries. But in Cameroon, incidentally, it's only in Cameroon that you have the two genetic types circulating at the same time. So that's what I can say about the causative agent of monkeypox. Thank you.
All right. Thank you so much, ma. We really appreciate it. Please, if you're just joining us, we are just starting and we're talking about the current outbreak of monkeypox in Nigeria. And we are here with Professor Marceline M. Baba, a medical virologist. Okay, sorry, a professor of medical virology from the University of Maiduguri, Nigeria. So she just told us about the monkeypox, what it's all about. And sorry to say that she apologized that she didn't prepare a slide to share. But after the program, that if you really need it, that it can be made available. But as it stands now, just bear with us and ask your questions wherever or whatever that confuses you when it comes to the disease of the topic monkeypox, that you can throw it out and she will answer. So the first question she answered now is what monkeypox is. Like if a layman comes now and he or she is asked, what is monkeypox? Can the person actually defend it? So that's what she just answered, the causative agent and things like that. And don't forget that you can actually ask your questions whenever you're confused using the chat room. Just drop your question there and we read it out. Or you raise your hands and the professor will attend to you. So thank you so much for your answer. Then secondly, after we must have heard about the monkeypox, we've now known what causes it. That it's caused by a virus. That is not a bacterial infection. It's not a parasitic infection, but specifically a viral infection. And you've told us the causes. Like, how can a layman, you've told, actually, when you were talking, you made a mention of some things like rashes. But to a layman, again, how can this be identified? Yeah, there are many rashes, of course, when that are caused by bacterial infections, parasitic infections, and all others. So how can someone actually, must it be through laboratory, like through laboratory tests that one can actually identify this disease? Or there's a way that maybe through physical examination that we can know that, okay, Mr. A is having this, let's run away from him. I don't know if you got me very correctly.
Yeah, I do. The main clinical features there that cannot be mistaken is the rash. The person has rashes, like I've mentioned before, and the type of rash is different from the rash caused by measles. Rash, like say heat rash, this rash is different. Like, let me repeat it. I said, this rash starts like a macule in the face that it has a flat base. Then it develops into papules. That papules means that you now have raised firm lesions. It becomes raised. It's no more flat, it becomes raised. Then these macules develop to papules that is raised, and then papules will now develop into vesicles. What do you mean? This rash will now contain some fluid. Fluid is inside. At this level, you call it vesicles. Then this vesicle will now develop into pustules. Pustules, that means lesion filled with yellowish fluid. And then from these pustules, it develops to what we call crust, which dries up and fall off from the body. It takes time for the skin to recover its normal texture. So unlike measles, the rash there is only called maculopapular rash. So from macule to papular and stops there, then it dries off. But this one will start from as macules, develop to papules, from papules to vesicles, vesicles to pustules, pustules to crust, and before it falls off. It takes time. It takes up to four weeks for the body to get back its original texture. So that's what I mean by, even though it accompanies with fever and so on, but the main clinical feature that you will say, this is monkeypox, is the pox. And then again, I want to say something. This, see, they all have this, they are in the same family. Monkeypox, chickenpox, smallpox, chickenpox, we've been hearing, we've been seeing. Pox is pox. There is what we call in egg, we call it chorioallantoic membrane, where you see the pox. If you put anything to do with pox virus, you see the pox there, like rashes on the chorioallantoic membrane of an egg. So when it's on the body, on human body, that's the kind of thing you see, that kind of rash. It starts very small, flat, then it becomes raised, then it becomes with fluid where that is clear, then the fluid will change the color, then you see it becomes hardened and then dries, falls off after drying. So I hope I've been able to clear that understanding about the how do you recognize, because you need to recognize even if there is no lab test. And why lab test is important is because that kind of pox, it can be caused by smallpox. It can be like chicken. How do you know that this is really monkeypox? The only way to know is by lab test, and that's PCR.
All right.
All right. Have I answered your question?
Yes, you've answered my question, ma. Thank you
All
so
right.
much. And sorry to say that we are still having questions here. We
No
have a
problem.
question from Abubakar Kabiru Musa. Let me read it out. He said, "My greetings to our dear mother and all fellow listeners. My question is there any similarities between monkeypox and other viruses like chickenpox and smallpox in symptoms or transmission processes?" That's coming from Abubakar Kabiru Musa.
Yeah, like I said, pox is pox. That's why you see all of them will end up in pox, whether it's smallpox or chicken pox or monkeypox. It's pox. The important thing at the end, you see pox there. And what is pox is the kind of the quality of the rash. But how do you, that's why you cannot use serological method to diagnose it because of cross-reactivity. They have what we call group-specific antigens, group-specific epitopes. So if we use serology, it's difficult to differentiate, but that's why the most recommended diagnostic method is PCR, that will pick the RNA of the particular species involved in the pox family. So pox is pox. And let me add something. You can compare it, let me say, compare it with something like measles. The rash, because all of them cause rash. Even some arboviruses too do cause rash. But like I said, these rashes from these other viruses are different. It stops at papules, where you have the macules developing to papules that is just raised. You have a raised region. It starts with flat, very flat, then raise a little bit, it stops there, and the rash goes off when the person recovers. But this one develops into pustules that contains the fluid that is yellow. Then after that one, it now forms the crust, the scab, that dries off and falls. And it's so conspicuous. It's hard at that level. It's hard. That rash, it doesn't just go like that. It takes a longer time for it to dry off and for the skin to recover its normal texture. I hope I've been able to clarify his concern.
Yeah, thank you, Ma. I think you have. And as we go on, the young man should be able to signify or maybe tell us that he had actually is satisfied. Yeah, which I think he should be. Thank you so much. Then the second question here is, what is the disease burden? It's coming from Oluwamuyiwa Ogunkoya. He's asking about the disease burden.
For now, from what I read in this one I read from the literature, that there are about 500 cases in Nigeria for now. And I think more than 200 have been confirmed. That means they must have done a laboratory test by PCR and confirmed that about 500 cases, suspected cases in Nigeria. That's the only thing I can say for now, based on what the information in the internet says about monkeypox in Nigeria.
All right. Thank you so much, Ma. Noted. Then the second question coming from the same person, Oluwamuyiwa Ogunkoya, is, a monkey is the source of the infection. I think you've answered that before. Maybe he joined before you, or maybe, sorry, after you answered the question. But Ma, sorry, don't be offended. Maybe you can just let him know about it again. I think it should be sweeter when you answer than me.
All right. Don't use the word, don't be offended. We are here for that. We are here to learn. We are here to get more information. So don't use the word offense, please. You cannot offend me. If you like, repeat the question till you get the clear knowledge, because if you have this half-baked information, it can be disastrous. It's better you get complete and clear information. All right, I said it that why it is called monkeypox, because it was first identified and isolated from monkey in 1958. The first human case was reported in 1970. So it's because the first time, it was isolated was in monkey. So from that time it was called, you can see between 1958, when it was first isolated from monkey, then it was in 1970 that the first human case was detected. That's why it is called monkeypox. Like I said, right now, WHO is, I saw some documents that they are trying to change the nomenclature. They want to change the classification instead of monkeypox, but that is not yet done. So we still refer to it as monkeypox.
All right. Thank you so much, Ma. Ogunkoya, don't be offended though. Sorry, I don't know how to pronounce this, your name. I believe you must have heard what the professor said. And if you are cleared, then you let us know about it using the chat room. Then the next question here is coming from Namuchi Peter Onoha. The question reads, what is the life cycle of monkeypox virus, and can the disease be transmitted?
Of course, indirectly, you're asking me, how is it transmitted? There are two components to that. First of all, remember, I said it that it's a viral zoonotic disease. And being zoonotic, that means it can be transmitted from animal to human and can be transmitted from human to human. Go back to animal. How is it transmitted from animal? And how is it zoonotic? I said it can be transmitted from direct contact with the blood or the body fluids or the cutaneous or mucosal lesions of infected animals, like animals handlers, animals slaughters, those that slaughter animals those that deals with animals in one way or the other, any form of animal, even though, permit me to say that the animals like squirrels, animals like, which other one, aside from squirrels, there are some animals that they say they can be even some pets, but what nobody has come out to say is which animal actually maintains the circulation of the virus in nature is not known, but rats have been suspected. So squirrels, rats, non-human primates, and some other species are reservoir of monkeypox, and including, I believe, some pets. It's likely, but it's not yet established in dogs, in cats, but there are possibilities. Let me put it that way. So up till now, the scientists have not established, just like COVID-19, they don't know which one is the natural reservoir of monkeypox that is maintaining the virus in nature. So I said from animal to human. Another way is, people dealing with these animals, if the animal scratches them or bites them, and these animals are infected, so that's a source of infection. Or by those who prepare the animals for food, for meat, they might be dress the animal or eat the partially cooked meat. That's from the animals that are infected. Or using the products, any kind of product of the infected animals, these are possible sources of infection to human. Then let's talk about human to human transmission. The main source is direct contact with the infectious rash, infectious scabs, that are the cross, that's the final stage, or even the middle, especially when it is still at the physical level. The physical, remember, it contains the fluid. It contains the fluid. The fluid is, even though it's not yellowish, but that fluid alone, if it's in contact with a skin that it has blisters or bruise, has wounds, then it's a very, very straightforward mode of transmission to another person. Another means is by, I've mentioned the rash, the scab, the body fluids of that contact between uninfected and infected. Another method of transmission between human to human is respiratory secretions during prolonged face-to-face contact, or during intimate physical contact like kissing, cuddling, or sex, because it is respiratory. So it can be transmitted through respiratory droplets, just like COVID-19. It can also be transmitted by touching some items or materials used by a previously infected person. For instance, clothing, beddings of an infected person can be a source of infection to the uninfected. And then it can be transmitted by pregnancy. Pregnant women to their fetus through placenta. It can also be during perinatal and close contact during delivery. So those are the methods that the virus can be transmitted. I mentioned as a summary: animal to human, then human to human, and in most cases, direct contact. Direct contact. It can be respiratory, it can be from mother to in pregnancy, mother to child, or during delivery as a result of close contacts. I hope I'm understood. I hope I've been able to simplify it.
Yeah, thank you so much, Ma. We do appreciate your concern. We appreciate all these your thorough explanations. At least, like you said when you started, that you want to use normal terms to avoid all these medical jargons. You are really, really trying, at least breaking it down to a layman's understanding. Thank you so much. And like I said before, I believe that the person that asked the question should be able to notify us in the chat room regarding his clarity. The next question here is, where is the origin of monkeypox? It's coming from Abubakar Kabiru Musa. Where is the origin of monkeypox? Not what is the origin. That's what it asked.
I was shocked. Like I said, that 1958, I've forgotten the name of the country. And then in 1970, the first human monkeypox was detected in DRC. Then the literature I read recently that Nigeria is exporting monkeypox to many other countries like UK, and that was 2018. But you know, they are conflicting this story, because they are now saying that monkeypox have been detected in non-endemic countries, and there is no historic link between the endemic and the endemic. That means there is these people that had it in non-endemic countries did not travel to endemic countries to acquire. So how? And for us in Nigeria, this is the first time I'm hearing about the outbreak of monkeypox in Nigeria. And the person that they detected, the last came to Nigeria in 2018. What is the linkage? Is what is personal is beyond me. I don't understand. But I can't remember the name of the particular country that it was detected, but in human, it was DRC. It was detected in DRC in 1970. So the person can get it from the net to know the exact country where it was first detected.
All right. Thank you, Ma. We appreciate it again. You just doing me as if I should become a virologist as well, like you. So our next question is coming from Abba Bola Mahmoud. And this is what he typed here. Good day, Ma. As a learned man from northern Nigeria, how can I differentiate smallpox, monkeypox, chickenpox, blast on rash? Okay, based on rashes appearance in human body. Let me go again. Good day, Ma. As a learned man from northern Nigeria, how can I differentiate smallpox, monkeypox, chickenpox based on rashes appearance in human body? That's a question from Abba Bula Mahmoud.
I will say it's almost difficult, almost impossible. That's why the only way to do so is laboratory diagnosis. Based on the rash, it's difficult, almost an impossible task to differentiate which one is smallpox, which one is chickenpox, which one is monkeypox. Like you said, all these things, they were named according to the source of the first isolates. The one they called chickenpox was first detected in chicken. The one that is called monkeypox was first detected in monkey. Then the smallpox, it was first detected in human. So it's difficult. The rash, like I said, pox are pox. They all follow the same pattern of rash because the main clinical feature there is the rash in pox infections.
Okay. All right. Thank you, man. Maybe before we go ahead, somebody's raising his hand. I think that should be Abubakar. Please, do you have anything to say? Do you all want to ask a question or want to say something? Abubakar, Kabiru Musa.
Hello.
Yeah,
Hello,
Musa,
yes.
what about you?
Hello.
Hello,
Yeah, we can hear you. Go ahead.
Okay, I find it very difficult to watch
because I can only listen to the audio. I don't know how the program is going on.
Yeah,
Sorry,
you
can
said
you come
I
again?
didn't get you.
We can't watch. I can't watch it. I can't watch it. I can only listen to the audio.
You know, might be you came late. I didn't prepare a PowerPoint. I didn't prepare because, in fact, initially I thought it was just going to be an audio talk. I didn't know that it's going to be Zoom. So I did not really prepare PowerPoint. So you are listening to the message, like I said, after this, I will be able to prepare PowerPoint so that the whole group, the executives will share it with the whole group. But for now, it's just a verbal talk I'm giving to the group. Is that okay? Hello? Abubakar, did you get me?
Hello, Abubakar.
Hello?
Maybe he's having a network challenge. When he comes online, he can continue then.
All right.
All right, so we can go back to the remaining questions here. The next one here is monkeypox a born disease? The question is coming from Abba Bulama Modu. She is asking whether the disease is an airborne type.
All right. That question, personally, I keep on asking the same question because you see, smallpox was, before eradication, it was an airborne disease. You know, is it the researchers? I don't know who are these people that come on to say. According to literature, I've never really researched on monkeypox or pox viruses generally. So I limit it with the knowledge I acquire from my basic knowledge in virology and what the literature says about pox viruses. So monkeypox, I remember in 1798, when Edward Jenner, that before he discovered vaccine, what they said was that the way the people were vaccinated, they used the exudate from the pox, from the flu, from the rash, and just smear it on people to inhale. Then those who inhaled were automatically protected. So you see, according to literature, they said it's not airborne, but it is transmitted through respiratory droplets. That means intensified face-to-face contact between the infected and the non-infected can aid. So that means within a short distance, where you talk, you sneeze, you cough out, the droplet there can be transmitted to the next person that is not very far from you. So respiratory droplets is different from being airborne. Like influenza is airborne. It's transmitted in the air. You don't even know which direction, whether you are close or not. When there is infection, it's airborne, it's borne by the air. But here, monkeypox, according to the literature, that it is respiratory droplets that requires a short distance, close distance between the infected and the uninfected that can facilitate the transmission. I don't know whether I've answered that question.
Yeah, well, you don't just to that. So let's get to hear from the person that asked the question as we progress. Thank you so much. So the next question is coming from...
Moderator, I want to place your indulgence that anybody that asks a question, if the person is not satisfied, the person should indicate it so that we can go further. There is no point to be dissatisfied because you did not really get it the way you wanted it. So that's why we are here.
It's all right, ma. We've heard you. Thank you, ma. So if you ask a question and after she must have answered, you have to tell us whether you are satisfied. Don't wait until, or maybe don't just ask questions and go offline. Stay here and hear what she will have to tell you. And if after her explanations and you don't get it, do let us know. And if you get it as well, do let us know so that we can progress. Thank you. So to the next question, ma, coming from Nafiza Zakir. The question is, how can monkeypox be prevented? How can monkeypox be prevented?
Yeah, that is a very good question, because for any disease of public health importance, it is important to know how to prevent it, because that's what we all need so that we can stay safe. All right. Like, remember, the mode of the prevention will be derived from the mode of transmission. And remember what I told us, it can be transmitted from animal to human and from human to human. Then let's start from animal to human. How do you do it? Avoid contact with animals that could harbor the virus. Everybody should, right now, with the epidemic of monkeypox, avoid rats in the house. Avoid anything to do with rats. And those who are handling sick animals, they should wear adequate PPE, especially like the veterinarians, the animal scientists who are dealing with animals, whether they are sick or dead. They have to be very, very careful, adapting appropriate precautions, preventive measures, especially the use of PPE, correct PPE. Number two, avoid any materials that are being used by the dead or sick animals. And then anybody that is infected should be isolated, just like we did for COVID. The isolation facilities used for COVID can be used for monkeypox patients. Then for human to human is to maintain the normal hygienic practices as were prescribed for COVID, which include frequent hand washing, distance, social distance, and isolation. So washing hands with soap and water, or using alcohol-based hand sanitizer and social distancing where possible. And then use of, for health workers, anybody working in the hospital or clinic, anywhere, taking care of whether taking care of sick people or taking care of old people, please use proper personal protective equipment. Yeah, I'm done.
All right, thank you, ma. Nafiza Zakiri, I believe that you are here with us. So you must have heard what the professor said. And I think that we should hear from you as well to know whether you are satisfied. So we can move on. Nafiza?
Hi, sorry to interrupt. So this is a webinar mode, not a normal Zoom meeting mode. So the attendees you can see on your Zoom platform cannot interact with you by simply unmuting themselves. They can only interact by typing their questions in the chat box. If at all anyone wish to ask the question by unmuting themselves, they can raise their hand so that I can allow that person to talk. Thank you.
All right, let me say it in another way. Just trying to say that the attendees cannot actually use the mic directly. That if you want to talk, you just have to raise your hands, then you unmute you directly, then you can talk. So as it stands now, if you are an attendee and you have anything to say, you cannot use the mic directly. All you have to do is just to raise your hands. You raise your hands up. And once you notice that your hands is up, then you automatically unmute your mic. Then you can speak and tell us what you want to tell us. And the essence of him muting your mic, keeping you muted so that we will not be having unnecessary distractions. So if you have anything to say, just quickly raise your hands and we get to hear from you. So Hafiza, it is our hope that the professor has cleared you, right?
Yes, I think we can move ahead to the next question, because the person Nafisa can also type the comment in that particular question.
All right, that's okay. So we can move on till we get to hear from Hafiza in the chat forum. So the next question here after the question from, okay, all right. I think I've seen Hafiza liked the, all right. She just replied, I'm satisfied. Thank you, ma. So she is satisfied, ma. So we can move
All
on.
right, good.
The second question, sorry, the next question is coming from Mr. Foster, and this is what he said. Good day, Professor. My question is, what are the physicochemical properties of this virus? And is there any vaccine available? Let me go ahead again. Let me go back again. Good day, Professor. My question is, what are the physicochemical properties of this virus? And is there a vaccine available? What are the physicochemical properties of this virus? And is there any vaccine available yet?
All right, thank you very much. Number one, like I said, a monkeypox virus is a DNA virus, and it is enveloped virus. Based on these two properties, you can even, anyway, like you said, many of you are not medical lab scientists, are not virologists, you may not know. So once you say the virus is enveloped, that means that virus is sensitive to the common disinfectants like alcohol, ether, detergents. They are easily inactivated by any of these disinfectants. Then that's number one. Number two, is said vaccine. Right now, there is no vaccine. There is no vaccine that is available for monkeypox. But like I mentioned it earlier, that anybody that has had chickenpox or had smallpox or was vaccinated against smallpox will be protected against monkeypox because they are related. They are serologically linked. They are immunologically linked. They are linked, so it's protected. But for now, there is no. You see, this particular infection, viral infection, it's self-limited. It comes, and before you know, it's 3 to 4 weeks. The person recovers. It's only few, let me say 1% that the person can have, 1% of the infected people can have complications. And such complications could be like pneumonia, and it would be as a result of secondary infection. So somebody can have bronchopneumonia, can have sepsis, encephalitis, and if it affects the cornea, it can lead to blindness. And that is in 1% of the infected individuals. So there's no vaccine, is self-limited. Pata 4 weeks and thereabout, everything. If the person eats well to boost its immunity, the person will recover before you know it. Though it may take time for the rashes, for the skin to really get back to. I think there are some creams you can use to smoothen and facilitate the recovery of the skin back to its original texture. I hope I've been able to answer the question.
All right, thank you, ma'am. We get to hear from Mr. Foster as we progress. Mr. Foster, if you are here still with us, then I think you should get to signify whether you are cool. Please, let me just make this little announcement. Please, if you want to ask a question, for us to note your question so that we'll not just skip it, it will be better that you ask it here in this question and answer session, not in the chat room. Because currently I'm taking questions from this question and answer session so that they will be in order. If you ask your question in the chat room, it may be delayed. Like to answer them, we have to go through the ones we are seeing here in this question and answer section. So please, if you want to ask your question, just go straight to the question and answer. You will see something there, click on it, then type your question and submit. Yeah, Mr. Foster indicated that he's okay. All right, so we go to the next question coming from Oluwamuyiwa Ogunkoya. Okay, this is what he wrote. Thank you for answering my questions, ma. I understand that smallpox vaccine is used. I understand that the smallpox vaccine is used for the meantime for vaccination against the monkeypox virus. But while we wait for a specific monkeypox virus, what would you say is the possibility of using virulation for preventing the disease? And in more general terms, what is the prospect of using virulation? Perhaps through improved technology in curbing many other viruses. Sorry, it looks a bit long. Let me go back again. I understand that smallpox vaccine is used for the meantime for vaccination against the monkeypox virus. But while we wait for a specific monkeypox virus, what would you say is the possibility of using virulation for preventing the disease? And in more general terms, what is the prospect of using virulation, in bracket, perhaps through improved technology in curbing many other viruses? I don't know if you grabbed that because it's quite long.
I
Maybe we
get.
can take it
I
a bit.
think I get. I get what. I get what the person is trying to say. Even in the history of immunology, when Edward Jenner used exudates of chicken pox to protect people against smallpox, and people frowned against it. It's a crude way, which is not, it should not be encouraged. Virulation should not be encouraged at all. We are, and even then, where will you see people with smallpox? The smallpox has been eradicated. So the only thing we are talking about might be somebody who had no. They are more better means of protecting. It could be transfer of immunoglobulin. There are so many other better modernized method of how do I put it? Getting people vaccinated or immunized against smallpox. To me, there is no need. It's better to just wait. Just like we waited for COVID. COVID came suddenly, and before we knew it, there had been vaccines. And if we still have smallpox vaccine, there is no need to start even thinking about monkeypox, because, like I said, they are serologically linked. Somebody that has chickenpox, smallpox, would be protected against monkeypox or any other one from the pox family. Any other one from the pox family, but not outside pox family. We have to know this. So there is no how any vaccine that is effective against pox, any member of the pox viridae will be able to protect somebody in coronavirus. No, it will not. Because there is no linkage. Every virus has a family it belongs to. Just like us human beings, we have our identity with our families, and there can be cross-reaction activities within members of the same family. There are some things one family will do to the other, it would be immunized, there'll be no reaction. But if it's another family, there'll be reaction. That's how virus families behave too. I believe I have been able to clarify that issue.
All right, Ogunkoya, as we progress as well, you have to indicate whether she has answered your question very correctly, so that at least you get to know your level of satisfaction. I think while that happens, then we should moving on. Let's attend to other people's question while he gets a reply. Hello.
Yeah, is there any confusion?
No, nothing. Maybe let's keep on going until maybe he comes online to clarify that he's okay.
Yes.
I think the next question is coming from Ogundare Taiwo James. Hello, Ma, can you hear me?
Yeah, I'm hearing, I'm listening.
All right. So I'm going to ask the question coming from. Sorry. The host, it seems you just mistakenly deleted the question I want to ask from Taiwo James.
Let me check.
Hello, did you share?
No, we have already answered.
Sorry?
We have already answered all the questions. So not the one which has been marked as answered, those questions have been already answered. So the next question is coming from Abu Bakr. You can ask the question.
Yeah. But there's a good question I wanted. I think the person raised that as a reply on that particular question I answered before,
Okay.
and I think is very very important. Sorry, is there a way we can bring it back?
Yeah, let me check.
All right.
So you can go to answer.
Okay, we can't bring it back. Sorry.
No, it cannot be brought back. You can go to answered section.
All right. So I think I can still remember the question he asked. Hello, Ma, can you hear me? I think I can still remember it. Let me quickly go through it. I mean, let me
I'm
try to know
hearing
what
you.
I
No
can remember
problem.
it. All right. So Taiwo, if you are here, if you are still listening to us, if I read your question very correctly, like if I can see by very correctly, do let us know. And if that's not what you asked before, then get to alert me as well. I think the question you asked is like this: like assuming that there is like currently there is monkeypox outbreak in Nigeria. Let's assume that we're in a community where there is no PCR that we can use for testing to know whether to ascertain that this person is having monkeypox virus. Then how can we know that this is actually what this person is suffering from? Then take caution or correction, like to avoid the spread. I don't know if you got what I mean. Like currently, there is a monkeypox outbreak in Nigeria. Now, you say that for us to actually ascertain that this is a case of monkeypox, that we need to use like something like PCR. Then he was asking, in a case like, for instance, you're in a community where you have no access to PCR, then how can you actually ascertain that this issue is caused by monkeypox virus, that you can take action to avoid putting the lives of those in the village or the community in danger? I think that's what I wanted to ask.
All right. Yeah, I've mentioned it that the major clinical feature of either monkeypox, chickenpox, small is pox. And what is this pox? The rashes, the peculiar rashes. So even if you are in a community and you are in the village where there is no PCR facility, and right now we know that monkeypox. So once you see this pox sign, I will still say it, the rashes, the rash that starts with macules, that's macular rash. What do you call it, macular rash? This rash is just flat. It's not raised. It starts just like small flat something on your skin. Before you know it, it develops into what I call pascules. It becomes raised, then it started being raised. You see the surface is being raised. From that one, it will change to vesicle. Vesicle is the one that contains the fluid. The fluid is the fluid inside. If you puncture it, the fluid inside is whitish, is clear. Then it will develop to pustule. Pustule now the fluid is yellowish. Then from there it will develop into crust or scab. That scab becomes hardened. It is hardened, then it will eventually dry and falls off. And when you start seeing this rash, it affects the extremities. It starts on the face. In most cases, it starts on the face, then it goes to the palms and then the sole of the feet of the person. Then it will affect the oral mucosa of the mouth. And then sometimes it causes, it affects the conjunctiva. And the eye, it affects the cornea of the eye. So when you see this kind of presentation, you don't need anybody, whether you've confirmed it or not. The important thing is, for every community, there is might be a health center. That person should be isolated. That person, they should be isolated immediately. Should be isolated, and everybody in close contact should make sure that they avoid close contact as much as possible, like family members, or they just stay together and they try to boost their own, eat what will boost their immunity, and continue with the common hygienic practices like frequent washing of hands with soap and with soap or detergent and water, and the use of hand sanitizer. And I'm just giving the person time to recover. Might be some other therapies, like we said, antibiotics to avoid secondary infection, to avoid complication like bronchopneumonia and the sepsis and the blindness because of the effect on the cornea. So that's what I can say. But as much as possible, the person should be moved to the hospital to the nearest clinic or hospital facility for treatment, and the person should be given enough fluid, a lot of fluid and bed rest, with some antibiotics and analgesic, because there is no real treatment specific for monkeypox. You can only treat symptoms and also treat against secondary infections. I hope I've been able to clarify that issue.
Yeah, I think so, Ma. Thank you so much. Please, Taiwo James, I think you should get back to us on the chat room. Let's get to hear from you. Then the next question here, Ma, is coming from Abubakar Kabiru Musa. I don't know whether, whether Taiwo James is still online, like we're still with us, because I told him to let me know whether this was the question he asked before. So if he's actually here, then he should get back to us to know whether the question was answered very correctly. Then to the next question, Ma, from Abubakar Kabiru Musa. The question is there a number of deaths that was recorded related to monkeypox?
Yeah, that is, in fact, monkeypox has a fatality rate of, is it 3 to something, I think 3% or 10. Yes, there is, but like I said, I mentioned it at the earlier, when we started the discussion, that they are of two genetic clades, genetic types. The one that circulates mainly in Central Africa and the one that circulates in West Africa. That of West Africa has been reported as not causing severe disease. That is not as pathogenic as the one that is circulating in South Africa. In Central Africa, like the DRC and so on. But except Cameroon. Cameroon is one country that has been reported that the two genetic clades are circulating there. So there is fatality rate, but it's not, you can't compare the fatality rate of monkeypox with that of COVID. It's low. I think about 3 to 6%. And now at this epidemic level, it's up to 10%. I read somewhere it's up to 10%. Yes, there is. And the death in most cases are common with people that have compromised immune competency. People that have problem with their immune system. They are not immunocompetent at all, immunocompromised people. like people that have HIV or on cancer drugs, or those that have compromised immune system are likely to face this complication. And people that have comorbidities, like maybe somebody having hypertension, having diabetes, other morbidity before now contracting monkeypox, those are the people that may actually experience death due to monkeypox. Otherwise, monkeypox, I want you to note something. In all viral infection, when I say all, I mean all, 80% of people infected are symptomatic. 80% are symptomatic. Then the remaining 20%, they may just show non-specific symptoms, non-specific, that fever, headache, anorexia, that's general body, general body pain. It could be like general weakness. That's in most cases in Nigeria, we will say, oh, it's malaria. That's the next line of action we'll think. It's only in 1% that you see the real complication. You see the real complication. In the 20%, the rash, these people that have rash will fall into the 20%. The people that will have complication and eventually death are likely to be about 1%. I hope.
All right, thank you, ma.
It's okay.
Yeah, thank you, ma. But if I got you very correctly, did you say that 80% are symptomatic or asymptomatic?
Asymptomatic,
Okay,
that means no symptoms.
They don't have.
They are apparently healthy while they are harboring the infection inside. And I want to use this. I want to use this forum to make it clear that it's possible for somebody to be infected without having disease. The presence of the pathogen in the body is infection. And this infection, the person can still be apparently healthy. That's why you say somebody's healthy. They say, no, apparent is from what you see. You didn't taste the person to know whether it's really healthy or not. So there is a difference between somebody being infected and then somebody showing symptoms of the disease and somebody not showing symptoms of disease and is yet infected. So in all viral infections, 80% of those infected are without physical symptoms. No symptoms at all. We call them asymptomatic. They are apparently healthy, but though infected.
All right.
Is that okay?
I've got you. Yes, very, very okay. Thank you so much, ma'am. All right, thank you. So the person that asked the question, Abubakar, you get back to us on the chat room. Let's get to know your reaction. Then the next question is coming from Lawrence Ako. And this is what he typed here. Good evening, ma. My question is focused on its prevention and control. What is your advice to Nigerians on how to manage this viral infection and prevention of the spread of the disease?
All right. I've answered this question, but let me still emphasize this. Like for any disease, whether it's viral or bacterial, the first thing that comes to anybody, a normal person, is how is this infection or this disease transmitted? How does it spread? Once you know how it spreads, you will know how to prevent it. Like in this case, for monkeypox, we know it's zoonotic. It's zoonotic. So it can be transmitted from animal to human. So those who are handling animal, especially sick animal or dead animal, the body fluids, body tissues of these infected animals could be source of infection to human. And then those who are really sick, especially the health workers. So you must use your adequate, correct PPE when handling sick people. And even those who are cleaning the hospital facilities, cleaners can contact it. So they must use appropriate PPE while doing their normal duties to avoid it. So the best thing is, how did we prevent the spread of COVID? We use the same method to prevent the spread of monkeypox. And by what? Practicing regular personal hygiene, frequent hand washing with water and soap or detergents, and use of non-alcohol based hand sanitizer. And as much as possible, anyone that has the virus with clear symptoms should be isolated. Those are the symptoms. To me, in my own way, that's the best way to prevent the infection.
All right, thank you so much, Ma. Already, I think Lawrence Ako has already liked the answer. I'm seeing a like here already, so that means that he's satisfied. Otherwise, then he should let us know using the chat room. So thank you so much for making this so simple. Then the next question is coming from, I think we've answered Abubakar. Yeah, the next question is coming from Falmata Balama. But really, I think this has been answered before, and perhaps she came late. She's asking the same question again. What are the signs and symptoms of monkeypox?
I have answered this many times. I have answered it.
You have really, you have.
I have answered it many, many times, not just once on this forum. So if you want me to still continue, it's okay. Like I said, let me start by saying that.
Sorry for the inconvenience, Ma. Please, if you are just joining us, maybe just get to listen to what she's saying. Perhaps she might actually touch what the question you want to ask, please, so that we'll not be dragging her back. Please, Ma, if possible, just go back to it again and tell us the symptoms once more.
All right. It starts with within 1 to 3 days. Now, let me say the incubation period. The incubation period varies from 6 days to 2 weeks. Sometimes it could take even up to three weeks. That's incubation period of the virus. And then it starts with fever. And that's what I call non-specific symptoms, like the fever, headache, anorexia, general body pain, all those symptoms that we will call in Nigeria, we will say, oh, we have malaria. Then within 1 to 3 days after appearance of fever, then the rash starts. And this rash, like I said, is evolving. It's not just boom, it starts like macules that is flat on the skin. It's flat. Then it develops to papules. Papules, then at this level of papules, it is raised a little bit. If you, at this level, it's just like the rash that is caused by measles. That's why measles, we call it maculopapular rash. It starts flat, then it raised a little bit as papules. Then from papules, it will now develop to vesicle. In the vesicle, it has the fluid inside. If you puncture any of those rashes, you see fluid, but the fluid is clear. Then from vesicle, it will develop to pustules. At this level, the fluid inside is yellowish. From pustule, it will develop to crust or scab. And at this level, it becomes hard. Then it dries off and falls off. At this level, it falls off the skin, but it will take time for the skin to clear to clear the scars and for the skin to come back to its original texture. And I mentioned it that in 95% of cases, it starts from the face. From the face, it goes to the palms. And then palms of the hand, then it goes to the soles of the feet in 75 cases. Then sometimes it affects also the oral mucous membrane in 70% of cases. And in about 30% of cases, it can affect the genitals. It can affect the genitals. And in 20%, it can affect the conjunctiva of the eye. And its effects on the cornea can also lead to blindness if it's not taken care of on time. So that's what I've talked about, the clinical features. So for anybody that is developing rashes and that rash is evolving, leading from one level to the other, to what we are talking about. The pox is different from rashes that is caused by measles. Those are the heat rash is completely different, You see that it's pox. If you go, any of you go to the Google and just Google pox, just put pox, you see how that rash looks like. It's very, very conspicuous. I hope that question will not come up again because I've answered it many times.
Yeah. You really did done justice to that. And even without being told again, I personally, I think I can teach a lot of people without reading again when it comes to this monkeypox of a thing. So thank you so much, Ma. You really done justice to these symptoms and whatever and signs of this monkeypox. So Abu Bakr, sorry, that was from Falmata Balama. So we believe that you have been cleared, is our belief. So to the next question from Nora Garuba. The question is, regarding laboratory diagnosis and tuition in differentiation between the all pox, what sample is suitable for investigation and stepwise to take in this task? Regarding laboratory diagnosis and tuition in differentiation between all poxes, what sample is suitable for investigation and stepwise to take in this task? But I think he's talking about the laboratory diagnosis.
I understand what the person wants. Yeah,
right,
for any laboratory diagnosis, you start with the symptom, with the specimen collection. Because if you use the wrong specimen, you have to study, you have to know what are the kinetics of immunity to that virus. Then that would guide you to know what method, what kind of assay should you use. Let's say for monkeypox now, the best sample is the skin lesion, like I'm telling you about the rashes. So from taking the roof or the fluid from the vesicles or the pustules or the dried crust, that's the scalp. When it dries off, that one that is dries off before it peels, you pick it, or you take the fluid from the vesicle, or you use the pus from the pustules. That's what is the best specimen for laboratory tests. If you use blood will not give you good results. The reason is that I don't know how I'm going to explain this without using some technical terms. The reason is that the viremia, that means the presence of the virus in the blood, is very transient. And you are collecting blood. The fact that you don't find the virus in the blood does not mean that the virus is not there. Because you see, there is what we call in pathogenesis. We talk about the spread of the virus. What is the site of arrival? It will where is the target organs? Where is the shedding organs? In this case, it's mainly the skin. So the best specimen that you will find the virus at any time is the skin, is the lesion on the skin. So the blood is not the best sample to collect for diagnosis. So the moment you have, the date of onset of the fever, the date of onset of the rash, then you know the date of sample collection, and then the current status of the individual. That's the stage of the rash. Is it when the person is having pustule? Is it at the vesicular level, or is it at the popular level? And the age. These are factors that will guide you to know whether you have taken or collected the correct sample. And then, like I said, you don't do antigen detection, you don't do antibody detection, it will not work because of cross-reactivity among the family, the members of the family box viridae. The best and recommended test is PCR. And being a DNA virus, you don't need to do RT-PCR, you do PCR because it's a DNA virus. It's simple. Just do DNA, and do PCR straight, and you get the RNA detected in the skin lesion, not the blood.
All right.
I hope it's
Thank you, ma'am.
Yeah.
Yeah, it has been answered very correctly. Let's get to hear from her while we progress.
Okay.
And I think the next question is coming from Abba Bulama. Sorry if I'm not pronouncing your name very correctly. Don't be offended. I think I should be going with Abba alone. So the next question is coming from Mr. Abba, and it goes like this: is it possible to be infected with the virus by contact?
It's mainly direct contact. But I want to make a comment there. If your skin has no blister, but we know that sometimes you can have a broken skin that you don't feel the pain. You don't feel the pain. You don't even know there is a wound there. So that's the danger of it. And then the second thing is that it can be through respiratory droplets. So contact with the infected person is the primary source of spread of the virus. So once you know somebody is having that, the best thing is avoid the person, avoid fluid, avoid close contact with the person. Like I said, the best thing is isolation. If it's in the family house, put the person inside the room, and then anybody going there to attend to the patient should wear appropriate, especially the mask, facial mask, to avoid the inhalation of the droplets from the infected person. Is that okay? Contact with the sick, contact with materials or items like beddings that's used by the sick person, contact with animal that is sick, or body fluid or body tissue, or items used for the animals that is sick with monkeypox. These are common sources of infection to anybody. Yes.
Yes, he has replied that it's okay. So he has said, thank you, ma'am. So move on to the next paper, which is coming from Najib Ibrahim. Please, ma'am, is there any might or speculation about this monkeypox?
Please, can you raise your voice? I'm not hearing you.
Okay, I said that this. Hear me now. Hello, can you hear me now?
All right. Yes, I'm hearing you now.
Okay, I was saying that the Abba has actually answered. Replied. He said, "Thank you, ma." So that means that he is satisfied. So the next question is coming from, yes, it's coming from Najib Ibrahim. So the question is, please, ma, is there any might or speculation about this monkeypox? It's coming from Najib Ibrahim.
You know, for anything that happens, even COVID is a myth. Abi, COVID is a myth.
Yeah.
When things like this happen, there is social approach to it. There is a scientific approach to it. There is a medical approach to it. You understand what people will give different meanings based on their own knowledge. I don't know. I don't know. So it's possible that there's a myth, but we are scientists and we have to approach things in a scientific manner. That these are virus infections. These are pathogens that can cause infections. So, and some are epidemic prone, some are endemic prone, some are just outbreak. or some are pandemic. So that's the only way. That's the only thing I can say. That is possible that there's a myth attached to it, which I personally am not what do you call this? Is it a methodologist? I don't know. I'm not good in that. I don't have business with myths, and I don't want to believe in them. I handle cases like this scientifically and conclude on it scientifically. So that's the best approach.
All right. Thank you, ma. I believe that Najib Ibrahim is listening to listening to you, so he should give a reply when he gets to hear this. So the next question is coming from Abdullahi Musa, and this is his question: does the monkeypox virus mutate like other viruses do? Does monkeypox virus mutate like other viruses? I think that's what.
That's a very good. Yeah, that is a very good question. Like, all right, I would say something here. Viruses are either DNA or RNA. So in this case, I mentioned it from the beginning that monkeypox is caused by monkeypox virus, which is a double-stranded DNA virus. So that means a DNA virus. DNA viruses mutate, but not at the same frequency as RNA viruses. The mutation in RNA viruses is far higher than that of DNA. But it doesn't mean that DNA viruses don't mutate. Let's see HIV. No, HIV is RNA. Let me see, I'm looking for another hepatitis B. You have mutants of hepatitis B. Hepatitis B is a DNA virus. So it's possible that you have different strengths, no mutants, but the rate is far less compared to RNA virus. Is that okay?
All right. Yeah, I think that's okay. So it's okay. So let's get to hear from her feedback as well. Thank you so much, Ma. So the next question, I think we should go to the next question.
Yeah.
And okay, and that's coming from Samuel in Yola, Ghana. And the question is, what is the surveillance systems in place for monkeypox?
I don't know whether there is, well, the fact that I don't know does not rule it out. There is surveillance system put in place, but I'm not aware. Even if there is, I don't know whether at the national level or the state level or the LGA level. I'm not aware. I don't know. I don't know. Really, let me use the word, I don't know whether there is surveillance system in place. But let's come to think of it, if there is no surveillance system, how did they know about the 500 suspected cases? Or is it, please, let me say what I'm so sure of. I'm a virologist. Yes, I don't know the other side. Yes.
All right. Thank you, Ma, for that and for being sincere as well. Then to the next question, it was asked by Foster, and the question is monkeypox virus prone to antigenic shift or antigenic drift?
I'm quite sure the person asking this question is a student. It's a student.
Very likely.
And I think this person may be my former student or still my student. Now, antigenic shift is only common in some virus families like mixo and paramyxoviridae. That's what I mean by influenza and para-influenza viruses. So monkeypox virus is not prone. And let me say again that the antigenic shift and drift is common with RNA viruses that are segmented. So such RNA viruses that are segmented are prone because they are so prone to what we call gene reassortment. The monkey virus is a DNA virus that is not. it may mutate. Like I said, the rate of mutation is not common. You don't really have many variants, mutants compared to RNA viruses. So does not undergo antigenic shift or drift. No.
All right. Thank you, Ma. I believe that this person has heard you. Foster, so you get back to us using the chat room as well. Please, let's stop asking the same question over and over and over and over again. I'm still seeing something like, what are the symptoms, clinical features?
Personally, I would not answer that question again because I've answered.
She has actually gone through something like that very over and over and over and over again. Please, let's not be doing her back. At least when you join, you listen to know whether she will say something regarding that. Please, please, please. There's some questions here that she has answered severally, and they are still coming up again. I think this one I'm asked by Chinwendu Ezeago and Emmanuel Nelson. I'm going to combine them as one because they are similar. And it goes like this. Is there any treatment against monkeypox? If yes, what? If no, how can we go about with a person already infected with the virus? I think the two of them have something in similar. That I was talking about the treatment.
In fact, no, it's a good question. I expected this question. Yeah, for now, there is no specific antiviral drugs specifically for monkeypox. However, there are some available antiviral drugs that are being used. And like I said, for vaccine, anybody that is still using smallpox vaccine is still being used against monkeypox. So, but there is what we call what do you call it? Symptom treatment, fluids, and good food to maintain adequate nutritional status is necessary. And then bacterial infection, treatment with antibiotics to avoid secondary infections is recommended. Then and there is one antiviral agent that is known as tecovirimat that was developed for smallpox, is also being used. And I don't know whether we have this kind of antiviral in Nigeria for now. So that's the only thing I can say. But there is no drug that is specifically, you remember what I told you, whether smallpox, chickenpox, monkeypox, pox, as long as pox, any treatment for one will save the other. Any vaccine for one will save the other. Any management for one will be the same for the other because they are so related. They are antigenically related. They are so related. So it's just the normal management, symptomatic management of the patient, and then a lot of fluid and good food, especially food that can boost immunity, that will help the patient to fight the disease and recover faster than expected. I think that's what is recommended.
All right.
Have I answered your question? Yeah.
Yeah, I think you have done that. We get to hear from them from the comment section. Then I think another question here that you are yet to touch, it should be coming from, sorry, I think I jumped it. Sorry. Okay, it's coming from Hamza Abdullahi. This is what he or she wrote here, so I don't know the gender. Thank you so much, Ma, for the lecture. My question is there any precautions when taking the sample or prior to assign for the diagnosis, like abstinence from certain things? That's what the person wrote here.
No, you see, like we said, I think this forum, we are dealing with medical lab scientists. So as a medical health worker, especially when there is outbreak like this, you must be sensitive. You must be sensitive to the environment. You can't be insensitive and just go to collect sample like that. No. In fact, like with this monkeypox, just like with COVID, anybody collecting sample, you must wear correct PPE. And especially, you should have in mind, how is this virus transmitted? So with that one, knowing how it is transmitted, it will guide you to know what kind of preventive measure do you take. And one of them is, as a health worker, you must wear correct PPE and handle the patient accordingly based on the preventive measures. You cannot just go and collect sample anyhow. You must do the needful. Handle with care, use correct PPE, avoid unnecessary touching, and wash your hand immediately with detergent, with soap, and so on. Have I answered it?
I believe. All right, thank you, Ma. I'm just going through the questions, and I think the ones who've not gone through, I mean, the ones who've not touched, because there are some that are just very, 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 very similar. The ones who've not gone through, who've not actually discussed here, should be from Abubakar Kabiru Musa again, and from One Techno Common 17 user. That's the username. Sorry, and this is what the person asked: what is the complementary binding site of the virus? Well, I don't know. Maybe I'm coming again. Then this is coming from Abubakar Kabiru Musa. When you are answering my question, which she said that the virus is divided into two, which are Central Africa and Western Africa. So what is the difference between the two?
The difference is in the genetic makeup of the virus. We call it genetic clades, or you can say lineages. I don't know whether this person understands that. You have people in the same family, they belong to one family, but you still have strengths in terms of strengths. Like you have, let me say, he's Abubakar Kabir. In Kabir's family, they have Abubakar, they have Aisha, they have Abdulhamid, they have Kazim. There are many of them. But you now have some strengths within the same family. But you see, this is Abubakar. They are like strengths that make up of the Kabir's family. And each of them will also have their own genealogy. But they can all be traced back to Kabir's family. So the same way, this is monkeypox. It belongs to the genus orthopox virus. And within this, and the species is what? Monkeypox. From this monkeypox, you have strains, and they have geographical location. You see, that's another interesting aspect about viruses. You see a particular virus circulating in a particular geographical region, and you don't find it in another place. Like that, this monkeypox, it is mainly the one that I called what do you call it, Congo clade. You only find it circulating in Central Africa. You hardly find it in West Africa. Then you also have the one that is circulating in West Africa. And according to literature, the one that is circulating in West Africa does not really cause very severe disease. It's just self-limited infection. But that of Congo, it causes very, very severe disease, even with complications. So you have viral infection, or viruses being impacted by the environment. And that's why you have geographical distinction in the strains that are circulating. Another interesting, let me mention another one, like West Nile virus. West Nile virus, they are of two types. The one that is circulating in Europe and America is called lineage 1. But the same serotype, but the lineages, the family lineages, There are some things that are make them to be classified into different family units, or is it based on the genetic makeup of the virus? They are placed in different clades. The same thing with polio. The same thing, you have polio serotype 1, serotype 2, serotype 3, but you still have the genotype. They are further split into genotypes. Is that, I hope I've been able to answer the question. It's based on the genetic makeup that you have, clade 1 and clade 2. And they differ in the different geographical regions where they circulate.
All right.
Have I answered the
you,
question? Mm-hmm.
You should have done that. I believe that is well understood. And thank you for that, ma. Please, we'll just entertain 2 more questions and we are done for the day. Please. We'll just entertain 2 more questions and we are done for the day. So the 2 questions should be coming from, okay, let's take one from that Techno 17 user. So that's the username I'm having here. And I think the last one should be coming from, I think, Huzan. So Techno 17 user here, the username I'm seeing, is asking, what is the complementary binding site of the virus and the appearance of the virus under a microscope?
I don't think I understand his question by saying the complementary binding site. We are going into technique, we are going to the real virology. That means we are going into the viral replication. Is it the viral?
That means that the question should be off point from what we're discussing today then. Hello, ma, are you still here? Hello, ma. Right, it seems she's having a network challenge.
Yes.
Okay. Hello, ma.
She got.
She seems.
Yeah.
Yeah, she seems to be held down by a network.
Yeah, that's right. Should we wait for a minute?
Yeah, we're almost done. Just for her to just answer the last question and we are done.
Okay. Okay.
Please don't be offended. Let's just get to hear her last comments. Then we can call it a day. It's almost 10 p.m. here. Don't be offended for the break in transmission. Sorry, Garuba, I'm not seeing this thing. We've already taken we can't entertain all the questions because everybody here would like to ask a question, and of course, we are dealing our time. Please don't be offended. We'll not be able to attempt your question again when she comes online. Maybe if you still have something else to discuss, or maybe you don't understand, when we are done, you can send that privately to me. Then I'll forward them to you and get back to you when she answers that.
I am also checking with Favor if she is able to connect with the speaker and we can get some information.
Sorry, can you repeat yourself?
Okay, so Favor is trying to connect with the speaker to know what is wrong if there is any technical issue because
Yeah,
she has not joined yet.
I'm trying to contact her on WhatsApp.
Okay.
All right. I think we can call it a day here. Her number
Okay.
is not reachable, so maybe we can call it a day here. Apologies for the break. It was never, maybe that time we're having underground background noise. That should be warning from her battery or something like that. I don't know. But currently her battery is not. I mean, her line is not going through. So maybe here we call it a day. Thank you for joining and thank you for participating. We really, really
Okay.
appreciate your time.
All right. So I'm
So
ending the
if she
webinar.
has not, yeah, if she has not gone through your question, apologies. Do forgive us and send them to me
Yeah.
on WhatsApp or send them to your chapter president. You should be able to send it to me on WhatsApp. Then I'm going to forward them to the professor, and whenever she answers, I will get back to you. Thank you for your time. We do appreciate.